Well, welcome back, everyone. You know, for those living with chronic arthritis pain and limited treatment options, a new non-invasive therapy is offering relief. So today, we're joined by Dr. Peter Laye. He's a radiation oncologist with the Lima Memorial Cancer Institute to share how radiation therapy is helping patients manage joint pain. So welcome, Dr. Laye.
Thank you very much, Chris.
Yeah, so doctor, can you explain how radiation therapy is being used to treat chronic arthritis pain and also what makes it different from more traditional treatment options?
Yeah, let me give you a little bit of history. About 32 million Americans are affected by arthritis every year. 90% of the patients are over the age of 45. Usually arthritis is affected by older patients. Female population tend to be affected more than the male population. Higher body mass index tends to affect people. Family history and previous joint injury. The most conventional treatment that we do nowadays is weight loss, physical therapy, and taking medication like non-steroidal anti-inflammatory. Unfortunately, chronic use of non-steroidal anti-inflammatory, especially patients tend to be older, it can affect the kidney. The 200,000 patients would experience cardiovascular accidents. It can cause GI bleed. Unfortunately, 25% of patients lose effectiveness over time. I mean, when you take it over a period of time, it won't be effective anymore. There'll be more invasive procedure like intra-articular injection, such as steroid injection, or non-steroidal anti-inflammatory injection, or even more invasive procedure like hip replacement, knee replacement, that people hear that all the time. Low-dose radiation is a non-invasive form of treatment. We learn from experience, low-dose radiation is extremely effective. It has a very high anti-inflammatory index. We aim at the affected joint. From our experience, it tends to eliminate significant pain in the area we treat. It's a non-invasive procedure, so it's another alternative treatment if all the other treatment fail or patients who do not want to have the conventional treatment.
Yeah, so who would be considered a good candidate for this therapy? And are there certain patients that don't qualify?
No, patients who we like to treat older patients, patients who failed the conventional treatment, meaning patients who've been taking medication no longer effective. Patient could not tolerate the conventional treatment. For instance, patients who have gastric ulcer disease, then non-steroidal anti-inflammatory would not be feasible. And patients who are not ready for more invasive procedure, so they want to give an alternative like low-dose radiation for try. Patient who is not qualified as a patient who is not on joint area or other than arthritis, like for instance, patients who have nerve pain coming from the spine to the joint, but there's no arthritis in the joint, it will not be effective.
Yeah, so when a patient receives the treatment, how quickly can they expect to feel relief? Like, how long does that relief typically last?
Okay, from my experience, most of our patients start experiencing symptomatic relief within 2 weeks after we stop the radiation. There's multiple studies that have shown 2/3 of patients continue to experience pain, symptomatic relief in 3 months, 6 months, and 12 months. I have also seen some study that patients continue to have reduction in pain 3 years after the radiation is completed.
Well, you know, what types of arthritis and also which joints might respond best to this type of therapy?
We tend to treat osteoarthritis, which is the most common form of arthritis, and rheumatoid arthritis. The area that tend to respond the most are the hands, the hip, and the knee.
So for those that are interested in learning more about this treatment option, so how can they contact you?
They can contact us at 419-998-4496. We're located at Medical Park, 525 North East Town Road.
All right, well, don't go away. We have more when we return.